Welcome to Plastic Surgery Secrets Talk, the podcast where we go behind the scenes of everything interesting in plastic surgery and the aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. Onir from the Spiegel Center just outside of Boston. We are excited for season 3 to continue.
Yeah. So what is hyperbaric oxygen therapy?
Okay, well, all around us, we've got air. Air consists of oxygen, nitrogen, some carbon dioxide, all kinds of things, and some minor gases. But the oxygen is the one we all need to live, right? It comes from the trees, gets into our bodies, and it's critical for destroying bacteria, promoting healing, and just increasing health.
It's like the essential ingredient in healthy metabolism.
Absolutely right. Without oxygen, you can't form energy, you cannot heal, and it's so critical, like I said, for killing bacteria and just righting things that are wrong. So, the oxygen in the atmosphere around us is at a certain percent and a certain pressure. But is more better? Well, in oxygen, turns out that within a certain range, more is a lot better. Mm-hmm. So that's what hyperbaric oxygen is. We're going to increase the oxygen in your body, in your tissues, and even in areas where you have poor blood supply, because blood carries oxygen and nutrients to your tissues. And even if you have poor blood supply, such as if you had surgery, got diabetes, you are a smoker, you have cardiovascular disease, you have vessel disease, even in those situations, the extra oxygen is going to get there and it's going to help your body heal. It's going to seem like, oh my gosh, look at all this oxygen. I haven't seen this in so long. Poof, I'm going to get much better.
So if I'm like a patient and I wanted to know, well, how does this actually work? Like, how do I get all this oxygen? I want more of it. How do you give it to me? So how does it actually work? Like, what do we do?
Well,
just breathe
in.
Breathe
in oxygen. So if you breathe more, you can actually sort of get more oxygen, but you also decrease the amount of carbon dioxide in your body, and that can be unhealthy eventually. So breathing too fast and rapidly can make you pass out and all kinds of problems. But you can get more oxygen to your body in two ways. One is by breathing a higher concentration of oxygen, right? So the oxygen in the air around is about 21%. Mm-hmm. And if you breathe air that is 42% oxygen, for example, you're getting more of the pure oxygen, and it goes into your body like that.
This is like the opposite of altitude sickness. Like if you go up in the Himalayas and you feel sick and weak and like you have no energy because there's no oxygen in the environment. Instead, we're doing the opposite. Like we're taking you down to where there's a much richer oxygen environment.
That's exactly right.
You'll feel like super powered, basically.
But on the other hand, it's like this pure oxygen that you get only in higher places.
That's true. So it's like you've risen up for clean air, no toxins, but a higher, it's the best of both levels.
So it's a higher percentage and it's pressurized.
Correct. Now that's the key part that you just mentioned. Tell us about that.
So you go into we have a special chamber, right? So our hyperbaric oxygen chamber is basically the special little encapsulated environment where you receive both of these things. You can do sessions, usually for an hour long. That's what I recommend to my patients.
That's right.
So it's easy to do it on like a lunch hour, or if you just come from a workout, you can come after workout. It's great for sports recovery. Do it on your way home, basically. If you're part of I think we have a VIP system.
Yeah,
right?
It's the Glow system, and so you can come like once a month, or some people will buy it in packages. So you do like 2 or 3 of them. Hint, hint. Marathon.
Yeah. So basically,
runners.
it's like having a gym membership. You can just come and stop by and use HBO.
It's actually better than a gym membership, because with a gym membership you have to do all that working out. And actually studies have shown that if you have poor fitness, poor like energy and strength, if you go into a hyperbaric oxygen chamber regularly, it is as if you exercised regularly.
But actually, let me just say that if you are a sporty kind of person and you do a lot of exercise, that's going to even increase it even more.
Absolutely.
And let's not leave out the sleeping, how much it helps with sleeping.
Helps with sleep for sure.
I think like 33% improved sleeping. Am I right about that?
But you're getting ahead. So I want to say one thing, which is, let's play a little game here.
Okay.
The game is, tell me something that hyperbaric oxygen improves. So you started with sleeping. Improve sleep.
Yes.
Surgical recovery. I've had 2 patients just today. One of them, a composite graft for ear reconstruction. 3 sessions of hyperbaric oxygen to help accelerate healing, help make sure our skin and cartilage grafts take, basically so we don't have a failure with a high-risk surgery.
Yeah.
Number 2, facelift patients pretty much universally benefit from this. anything where we have perhaps tissue ischemia, loss of blood supply from surgical dissection, pretty much anything, or revision rhinoplasty, universally going to benefit. And even where you could say, well, it's not essential that you have hyperbaric oxygen, they're still going to speed up those metabolic processes and get through their surgical recovery faster.
100%, and I'm a walking, talking.
And I tell people, you can't overdose on this.
Yeah.
You don't want to live in the chamber, you can't be in there 24 hours. But if you come and do it daily, that's actually there's really not too much of a good thing in that kind of context.
That's true, and I'll add on that it's good for, just to make this game end, but I'll add on that it's good for hearing loss. That's currently the standard protocol for sudden hearing loss is steroids and hyperbaric oxygen. That's the current state of the art. Yep, that's the current state of the art and best practice. Then they also have it good for orthopedic injuries, for diabetes, for they say it might be good for fertility treatments. People who are undergoing fertility treatments.
Is that a rumor? What's the deal behind fertility treatment?
Well, I don't do a lot of that anymore, but my understanding is that the early studies show that if you are undergoing fertility treatments or trying to get pregnant, that hyperbaric oxygenation can improve the success. And it kind of makes sense, right? Because it's going to probably make the uterine lining more robust and healthy, make it a more receptive environment, things like that. It's good for lung disease. Mm-hmm. It's certainly good for your skin. They've shown that it is anti-aging. It's probably good for hair growth, makes you feel better. I think it's good for just about anything unless you're claustrophobic. But even then, it's not so bad. It's got a nice window, and it's a pretty big chamber. I mean, this is like a business class airline seat.
Yeah, it's more than a business class. Yeah. And long-term COVID.
And long COVID, if people have had COVID symptoms.
Had a number of patients for long COVID.
Exhaustion, absolutely. It's fabulous. So, Dr. Onir, you have a personal experience of using this after a procedure. You want to tell us about that?
Well, look at my eyes. I had my eyes done just about 3 weeks ago. 3 weeks ago today. Exactly. Wow. And look at the healing. So, my personal experience.
Visibility, unless you pointed out to me.
You wouldn't know.
Yeah.
Well, this guy knows I had it done.
I saw it happen.
I'm pointing at Dr. Spiegel for those that are listening and not watching. I jumped into it right after the procedure and went every day right after. And about second or third day into it, I felt like I was sleeping at night like I haven't slept since October 2023. I swear.
For better than a year
I just
and a half.
have not slept that well. So all of a sudden I was sleeping better, and then I was back at work on day 5, and people looked at me and they were like, "Oh, I couldn't tell you had anything done. You just look so much more rejuvenated and kind of prettier." Yay.
Yeah, it helps with bruising
but they
and
couldn't
swelling.
tell that what was going on. And by day, a week out, I didn't have any of that swelling and anything else. And I had patients who said to me, "Oh, well, my mom had it done, had the upper eyelid done years ago, or someone else that had it done." And there are all these horrible stories of being really swollen for a really long time. Well, the first thing I always say is you got to pick the right surgeon. So you set yourself up for good results.
For sure.
These two guys. But the HBO helped a lot with the healing. Mm-hmm. So, of course, you have to pick the right surgeon to have the right procedure done with the right number of sutures and all of that. But then putting the hyperbaric chamber just improved the healing so much, and all the side effects of it, of the better sleeping, of just the better heal. I mean, all of it was just
There's
amazing.
got to be some negatives. So what are the negatives of it? Negatives of hyperbaric oxygen.
The 1 hour that I had to sit in there, and I was like, oh my God, it's 1 hour. What am I doing? But you know what? I didn't work out.
Download this podcast ahead of time. Get a few episodes for your hour.
Yeah, exactly. You can bring your phone into the chamber.
You actually can bring your phone in there. And then halfway through it, I was just dozing off and sleeping. So it was actually really nice. But I didn't work out that first week, and didn't gain any weight, didn't feel any loss of energy, none of that. And that's what you get with HBO.
About as good as it gets.
Yeah.
There's really not much downside here.
I always say it's like Botox. All the side effects of Botox are so nice, decreased depression, decreased headaches. All those things are it's just such and not to mention the fact that you look so much better when you do Botox. So it's kind of like that with the HBO. You just look and feel so much better.
But on a more serious note, it's not for you if you have a lot of pain when you fly. If you have pain with pressure changes in an airplane, it's going to be more difficult because it is a pressurized chamber. And we will show you how to do it.
Right.
Yeah, we have to show you how to equalize the pressure, which you do by swallowing and blowing your nose and things like that. So if you have severe sinus problems, if you have an active ear infection, just like flying would hurt, it's probably not the right thing to be doing at that time. But even after surgery, when your ears can be somewhat congested, people are always fine.
Yeah. So we love the HBO.
Yeah, it's been a great addition. It's speeding up healing, and it's part of our enhanced recovery package, which is helping people to get past the fun of surgery and back to everything they used to do before.
And rumor has it that y'all, the surgeons here, you just like after surgery, like some of you go
Sneak
in
in
there
there.
for sneak in
that's
there
the
for
rumor
like
going
that's the
around?
rumor that's
I
going
can
around.
neither confirm nor deny.
Yeah, keep my routine secret.
Yeah, like for half an hour or 45 minutes after surgery. It does help a lot with joints and all kinds of things like that. And so it is a beautiful thing.
All right.
Thank you for listening to Plastic Surgery Secrets Talk. If you like what you heard and you want to get in contact with us, you can call 617-566-3223.
Oh, I got that number. 617.
I know, that was like playing if you were listening to this podcast at 1.5x, you really didn't hear that.
Slow it down. 617-566-3223.
Yes.
Or email us at info@drspiegel.com or follow us on social media at Dr. Spiegel.